Hello students, welcome to Dr. B.R. Ambedkar Open University. Let's get into the classification of hospitals. So, what are the classification of hospitals? Hospitals can be classified based on various factors according to ownership, according to the objectives, according to the system of medicine and according to the level of care, according to the size, according to the clinical basis. So, now what is according to the ownership? Whether it is a trust hospital, whether it is a private hospital, whether it is owned by a government. So, in this we define a hospital by its ownership according to the objectives, like what is the objectives of the hospital, whether it is a primary care or secondary care or tertiary. Now, according to the system of medicine, what kind of the system of medicine are they following? Unani, Ayurveda or any other form. Now, according to the level of care and according to the size, whether it is a single specialty or small scale hospital or a multi specialty hospital, according to the clinical basis also. So, according to the ownership, government hospitals run by central, state or local governments. Get into the examples: private hospitals owned by individuals or private organizations. For example, Apollo, Yashoda, Care, KIMS. What are the government hospitals? Gandhi, Osmania, NIMS, so on, and voluntary and charitable hospitals managed by trusts, NGOs or religious organizations like Satya Sai hospitals, Tata Trust hospitals, etc. Now, according to the objectives, so general hospitals provide treatment for various diseases. Specialized hospitals focuses on specialty such as cardiology, cancer, maternity or psychiatry. For example, Omega, it's a completely oncology service oriented hospital, whereas Narayana Hridayalaya, which is completely focused on cardiology, and other hospitals like Asha, which considers most of the psychological problems of the people. Now, teaching hospitals, which also provides medical education and training along with the patient care. For example, NIMS, Apollo and others. Now, according to the system of medicine, Ayush hospitals, which considers Ayurveda, Yoga, Naturopathy, Unani, Siddha, Homeopathy. So, allopathy hospitals, which are like modern or English medicine in commonly language what we call. So, according to the level of care, primary care, secondary care, tertiary care and quaternary care. Now, according to the size, large hospitals 500 plus beds, medium hospitals 200 to 500 beds, small hospitals 200 or less than 200 beds. So, according to the clinical basis, teaching hospitals, rural hospitals, district hospitals, referral hospitals. So, let's get in depth of what are the differences or what exactly are these different types of hospitals. As I told, what are the hospitals owned by the ownership? I have given the examples. Now, according to the objectives, so general hospitals which provide treatment for various diseases. In general hospitals, there is no particular specialization and it's commonly taken care of the preliminary care or first aid things of all the basic diseases. In specialized hospitals, focuses on single speciality and the more focus will be and complete specialization of a single problem or a single specialization will be done in that. Whereas in teaching hospitals, what happens is most of the hospitals consider research, also provides real hands on patients for the learning doctors to expertise their skills. In teaching hospitals, most of the hospitals also have medical schools associated with the teaching hospitals. According to the system of medicine, as I told, Ayush hospitals, which usually considers Ayurveda and Yoga, Naturopathy, Unani, Siddha, Homeopathy. So, now according to the level of care, primary care. In primary care hospital, what happens is basic health care and basic first aid, basic things are provided to the population of the particular area. In secondary care, you can see minimal minor surgeries, minor things, minor OTs, minor problem care taken by the or treatment given to the patients. Coming to the tertiary care, in tertiary care you can see a well equipped hospital having multi-speciality doctors or n number of nurses, proper setup, proper care and all. In quaternary care, what happens, it's a completely established, research oriented, fully formed and highly infrastructured hospitals will be there. Now, according to the size, so what happens in this segment is large hospitals which are 500 bed plus beds hospitals like Apollo and other multi-specialty or big hospitals. What are the medium hospitals? We can see mostly in medium hospitals we can see only single specialty mostly, or sometimes even multi-specialty, but with less quantity of the bed occupancy. And small hospitals like Med United, or we can see other small hospitals like Chala nursing homes kind of, and small hospitals. These comes under which are less than 200 or like 200, small nursing homes or a single physician oriented hospitals kind of. So, according to the clinical basis, teaching hospitals, rural hospitals, district hospitals, referral hospitals. So, these all hospitals basically concentrates on a particular geography of their area, like teaching hospitals. If the teaching hospitals, what happens is they will completely have a medical school oriented to them, they will have a research institute oriented to them, where the main focus will be on teaching and training the staff and training the doctors, teaching and training the nurses and other paramedicals and physiotherapies, all other healthcare providers, where the main focus will be on teaching and training them. Now, rural hospitals, these are established for the rural areas where the minimum basic healthcare is to be provided. The main concentration is to provide them the basic healthcare, the basic first aid and the basic treatment for the precised rural area. District hospitals, these are the hospitals which are like a headquarters or a head hospitals for a particular district, where all the population of the district can reach out to the district hospitals for their medical needs. And referral hospitals, what are referral hospitals? To be precise about the referral hospitals, suppose if a patient has reached a teaching hospital or a rural hospital where they don't have the facility or for the higher treatment levels, these are sent to the referral hospitals, where most of them will be the research or a highly tertiary hospitals or multi-specialty hospitals, where the treatment can be provided for the population. Like from the teaching hospitals, these referral hospitals will get their referrals from the teaching hospitals, rural hospitals, district hospitals and other small scale nursing homes, single or doctor oriented clinics and all for this referral hospitals.